Pleasant good evening to everyone joining us from Grenada and the Grenadian diaspora. We have another session for you this week, Ask the Expert, and today we're going to be focusing on population health and immunity. As a reminder, we are a group of Grenadians in the diaspora in collaboration with the Office of Diaspora Affairs in Grenada. By way of introduction, my name is Jill Patterson, and I'll be your moderator for this evening. And we have an amazing team of panelists here with us today. They each have expertise in various areas. So we'd like to spend a few minutes just introducing our team, and then we're going to dive into our session for today. So first of all, I would like to introduce Ms. Nikisha Charles, and she is a clinical and data analyst for one of Brooklyn's preeminent health centers. She has a Master's of Public Health, in epidemiology and biostatistics, with over 12 years experience in community healthcare, and works with at-risk and underserved populations. Along with her team, she has been recognized by the Community Healthcare Association in New York State for improving cervical cancer screenings. Although she lives in Brooklyn, she's a Grenadian at heart and a convent girl as well, and hails from Ladig, St. Andrews. She wants you to know that she misses everything about Grenada, but most importantly, she misses those impromptu conversations we have with our neighbors and just those pleasantries you get from Grenadians. So, Ms. Charles, I'd like to welcome you to our session today.
Thank you for having me.
It's such a pleasure. I am now going to introduce our next panelist. So we have with us Dr. Ibrahim Wali, and he works for the NHS in the UK as a primary care physician since 2009, where he manages conditions and medical conditions specifically and coordinates health planning and promotion. He holds membership for the Royal College of Physicians and the Royal College of General Practitioners, and works with the Health Commissioning Group to plan and implement services in his local context. Right? He is deeply involved with the vaccines rollout since January 2021 and deals a lot with vaccine queries and patient education. So he'll have a lot to share with us about that. He is originally from Nigeria, but works closely with Afro-Caribbean communities and shares a fondness for our Grenadian culture, particularly our carnival and Jab Jab and Soca. So we welcome you to our Grenadian session today, Dr. Wali.
Hello, everyone. It's good to be here, and hopefully it'll be a very good session.
Thank you so much. And our final panelist, but by no means least, we have Dr. Jude Phillip, and he is an assistant professor of biomedical engineering, chemical and biomolecular engineering and oncology at St. Johns Hopkins University. He has over 11 years experience in his field, and his lab uses math and engineering approaches to study aging dynamics in health, disease, and cancer. A large part of his work focuses a lot on immunity and predicting medical intervention in collaboration with physicians. He currently lives in Baltimore, Maryland, but is originally from Grenada in Maribor, St. Andrews. And he wants you all to know that he misses his family and friends most of all, but also our local Grenadian dishes and the lovely beaches, okay? Of course, who wouldn't miss that? So thank you so much for joining us, Dr. Phillip. We welcome you to our session.
Yeah, happy to be here.
All right, great. So our session today really focuses on population health. And I think one way we can introduce it, and I'll chat with you first, Ms. Charles, if you could just explain to us some of the differences between public health and medicine and why we need to understand those differences when it comes to looking at the impact of COVID in our community, and just a general sense of what population health means to you.
Thank you, Jill. Thank you for your kind introduction, and welcome everyone to our panel. Hopefully it's edifying for everyone that's here. So medicine and public health, though similar, are very different. Medicine, in the general context that we always think of it, is an individual scoped practice, meaning generally one patient goes to one physician for one problem at a time. Public health, however, is a population level science. So it is based in data, evidence, and practice, and is interdisciplinary, as opposed to medicine where we're focusing on the individual level. The major difference between medicine and public health is the scope of practice. So one physician, one patient, whereas public health is for general populations. So that's one difference. And in the context of COVID and public health and medicine, many persons make decisions based on what they think is best for them at an individual level again. Whereas public health practitioners work interdisciplinarily to figure out what's the best course of action for a country in context, a community in context, the world in a greater context. And this is based on readily available statistics, evidence from past events, and it's usually extrapolated to context of what can happen if certain things are put in place. So when we speak of COVID and we see the things that are coming out based on policies and information data based on what's happening now, we have to figure in context of this is not just an individual thing that is being discussed. It is a general and a population level impact that we're researching. So that's generally what the differences between public health medicine and public health and general medicine are.
Okay, thank you. Thank you for that introduction. And then I guess that is going to point to when we're looking at social responsibility when it comes to keeping ourselves safe, it's not just about ourselves, but our community as well. All right, thank you so much. Dr. Wali, could you, as we're looking at population health, and we want to take a look at just the pandemic and the rollout of the vaccines. And I think that you've had so much experience in that. So I'd like if you could share a bit about that. What were some of the challenges and lessons learned that you found during that time that you'd like to share with the Grenadian community?
Yeah, thank you very much. As we all know, it's been a very difficult, probably getting to 2 years now since COVID was first reported in December 2019. And at the beginning, it was very difficult because this was a virus that was spreading across the population. We didn't know much about it, and there were huge amounts of deaths. I think everyone saw the horror pictures coming from China, from Italy, from the UK, and there was nothing to protect you. So apart from using PPEs, which are personal protective equipments, to try and reduce the risk of getting these infections. Now, as the year went on, it was really good that there was a good research going in to do the vaccines, and there was a lot of money that was pumped into there. We had all the experts all working together. We just saw, humanity come together, the science community coming together so well to actually develop a very good vaccine program. And eventually the vaccines came out. Now, because they came out so quickly, when you look at it from the public health or from where the public look at it, I think generally any human being, you would be anxious about anything that's new, especially it's being injected into your body, and you're not sure what's going to happen. And that was the difficulty. I think there was a lot of reluctance to accept the vaccine at the beginning. Particularly in the younger age group, and in the Black and ethnic minority group as well, we had a lot of vaccine hesitancy. Funny enough, the older population were quite happy to have the vaccine. And I think that relates back to historical terms, because we always have to look at it that we've grown up in an era where we've all been healthy, and we haven't really seen diseases that have caused a lot of deaths. Well, I remember one of my older patients saying, or they remember the days of smallpox, and there were a lot of deaths happening with that. And the vaccines came in, and that just stopped or just reduced, and all the way they eradicated the disease. So that was one of the reasons we probably saw the elderly population were taking it up more. Rolling out the vaccine was the next, it was a big mission. So I'm speaking from the UK point of view. We approved, well, in the UK, the first vaccine that was approved was the Pfizer vaccine. And so this was a vaccine they have to have 2 shots, about at least three weeks apart, which in the UK, we extended it up to 3 months apart. And it was just rolling it out. It's finding, it was a big project. We have to get everyone registered, making sure that the invites are sent to the right group. There wasn't enough vaccine coming through for the demand at the beginning. So we had to kind of make sure that there are priority groups for each vaccine. And eventually, as more vaccines came out, AstraZeneca came out, Moderna came in, that sort of improved. So it was really a big mission. And we did see, once the vaccines come out, that the number of deaths and the really unwell patients reduced quite significantly. Didn't stop, but it certainly, we're seeing a lot of results from that. And I think it was a very good experience. And I think we had so many questions. That's why got a lot of patients, and from hesitant ones to ones that just were a bit fearful because of the other health problems they might have. And we got a lot of experience speaking to everyone. We made a lot of frequently asked questions, which we distributed to people. And we certainly saw the uptake in the UK. And I think if that model can be pushed across the world, I think there will be a lot of people accepting the vaccine, and the rollout is really important. So I don't want to speak too long for now, but I think there'll be lots of questions that will come up, and more than happy to answer.
Yes, thank you. And we will talk a little bit about some of the hesitancy you saw, and maybe, the reasonings behind that, and, advice you have for people who may still have that hesitancy towards the vaccine. So I'd like us to dive a little bit into the vaccines themselves. And so I'll ask you, Dr. Philip, could you describe for us or explain for us the science behind the COVID vaccine and sort of how it works with our immune system, and maybe even starting with a definition of the immune system, like what it is and what can we understand by it, and why is it so important? We need to understand this when looking at the vaccine.
Yeah, so vaccines have been around, just starting in terms of being very general. Vaccines have been around for a long time, right? And for many years, even decades, it's been one of the key measures that have been used to really protect the population against a variety of different diseases, from smallpox all the way up now to COVID, right? So what a vaccine really tries to mimic is to try to mimic what the response to mimic the immune response that comes as a result of exposure to some pathogen, right? And when we say pathogen, you can think of it in terms of a virus, a bacteria, or some other microbe, right? So what the vaccine is a controlled decoy, right? So you want to give your body exposure so that your body can learn how to combat that virus or bacteria or that infection, right? So in terms of the immune system, many times in science, we tend to think of it as an army, right? So in an army, there's many different, there's different people, right? And each person may have a different role, right? So the same thing with our immune system, we have different cell types within our body. So we have B cells, we have T cells, we have macrophages, we have dendritic cells, and they all function in concert, right? So in order to develop a proper immune response, they need to be functioning in a coordinated manner, right? So there are certain immune cells in our bodies that are just there to surveil, right? So they're the ones just looking out, and we think of those as more our innate immune system, right? So when our body encounters some bacteria or virus, these are some of the first cells that starts to respond in terms of the cascade of events that happens. But ultimately, what we want to happen is a lasting immunity, right? which happens when our B cells become trained to make certain antibodies, and these antibodies are proteins that, the neutralizing antibodies go through our bodies and maintain some level of immunity. And then we also want our T cells to be able to recognize these foreign bodies and be able to kill them, right? But not only kill it at the first instance, but you want them to also have a level of memory that if it encounters that virus or bacteria or pathogen again, it can mount a similar response. So in terms of the vaccines for COVID, there are a couple different vaccines that are used across the world, right? So in the US, there's 3 main ones that they use, which is the Pfizer, the Moderna, which are 2 mRNA vaccines, and also the Johnson & Johnson. In Grenada, right now, I think it's the AstraZeneca one and the Pfizer one, right? So in comparing the two, there are certain differences that you have between the AstraZeneca and the Pfizer. However, the ultimate goal is the same, right? The goal of those vaccines is to expose your body to to the decoy so that your body is able to mount an immune response and be able to manufacture either the antibodies that would protect you against any encounter with COVID, as well as train your immune system so that you now have memory cells, specifically memory B cells and T cells, that if you encounter it again, you're protected in some manner.
Okay, thank you. Thank you so much for that. And we'll come back to vaccines in a bit to look at immunity, herd immunity, the difference between natural and vaccine-acquired immunity. But before we do that, I want to jump back to the topic of population health. And I think one thing that we want to establish is the information that we get and how reliable that information can be. And I know when it comes to COVID and statistics, especially with regard to mortality rates, there is a lot of mistrust around the statistics. So I'd like to ask you, Ms. Charles, if you could, first of all, tell us, why do you think there is a lot of mistrust around the data surrounding COVID? And then probably give us some insight into how the data is gathered, how it's disseminated, and why we might be able to trust it.
Excellent. Most of the distrust is, credible distrust, credence based on past experiences of persons who look like us or belong to populations like ours. We have, seen stories, watched movies, heard people who have experienced syphilis experiments and the Tuskegee experiment and the injustices that were done to people that look like us in the name of science in the past. So that hesitation, that hesitancy, and that mistrust is not totally unfounded. What has happened is that with the passage of time and with more, not enough, but more people that look like us in spaces where decisions are made or where clinical trials are run, and with improvements in informed consent and checks and balances to ensure that populations are not, at the wrong end of science. Most of the time, we can say with a fair level of certainty that we can depend on the statistics and the information that we're being given from the scientific community. To what level most people trust that's a conversation for a different topic. But in general, when it comes to statistics and gathering information, the first rule of numbers and statistical analysis is garbage in, garbage out, meaning the information is the analysis is only as good as the information that you're given. So when it comes to data on COVID and raw data on COVID, and I think the misconception that a lot of people have is that the data is just as it appears. The numbers are just as they appear. The thing with numbers is that they have to be analyzed in context of what is being assessed by the data. Meaning, I can tell you that 1,000 people died, but in that subset of 1,000 people, many people may have had different things that we call comorbidity. So the percentage of persons who've had diabetes or hypertension, and there are ways that you can analyze that data. And the COVID data is, I think the dire nature of the pandemic was reached back in like 2020. I remember reading a study where they calculated a ratio called excess death. So excess death is a ratio that's calculated based on historical and projected numbers of deaths from any form of illness within any subpopulation at any point in time. So meaning, based on how patterns were established back, or data has been collected and analyzed, let's say we're analyzing the period 2015 to now, I can expect within a level of certainty that this is the amount of deaths that we can expect of under normal conditions of persons in that community. What happened with COVID is when they started calculating excess death in the pandemic, they found that the excess number of deaths was exorbitant based on what was given context in the pandemic. And that's what we're seeing now in Grenada also. For a period from August to, let's say, October, if we're looking back 2015 to now, we can expect a certain number of deaths. But given that we're in the middle of a pandemic, we have a certain excess number of deaths that we're dealing with that we can attribute to one direct source, and that is COVID. So manipulating and interpreting data is scientific for the most part. And many people don't understand the nature of the analysis because, again, in public health, we deal with something called public health communication. And I think when the information is not presented in a way that the layman can understand, we come up with issues of mistrust, further mistrust of the numbers that we're seeing. So I think context needs to be given to numbers. Numbers are not ones and zeros only, but they provide a context when analyzed differently. So COVID mortality rates or case fatality rates are of the number of persons who were diagnosed with COVID, that's the denominator, this number of persons died. So of the 100 persons who were diagnosed with COVID, let's say 20 persons died. So 20 over 100, that's 20% of so the case fatality rate of COVID in this example would be 20%. But if we extrapolate that to the total number of deaths for that period, the mortality will go down because COVID deaths are only a factor of the deaths that occurred during that period. So the main thing about statistics is understanding that they're analyzed to certain standards and they present the information that is needed to be presented in context of what is the question being asked. So data can be accepted as valid and will only be accepted as valid in the scientific community after being validated repeatedly. There are steps that data has to go through before it can be accepted as a standard. There are standards that have to be met before something can be presented. So numbers are not just numbers for numbers' sake. They have to be analyzed and interpreted.
Okay, thank you. I think that that's important. And I'm guessing from what you're saying is that when we see the numbers, think of the context, right? So let me just ask a related question, because you mentioned the numbers changing probably over time or when they've been replicated enough. So what sort of trends do you see or foresee for the impact of COVID? And we can do that worldwide, but also for the Grenadian community. So over time, what do you think the data is showing?
And this is where interventions come in place. So with the prevalence of immunization, with the prevalence of vaccination, as more people get vaccinated, then we can foresee a downward trend in the case fatality rate of COVID or in the number of infections. But that's all dependent on maintaining safe practices. One thing goes before the other. We have to maintain safe practices, get vaccinated, do what we need to do to ensure that the data that we're given reflects accurately the situation on the ground. So trend-wise, with an increased uptake in vaccination and increased adherence in protocols, we can expect the trajectory. Usually epidemics and pandemics go in a bell curve. So you peak and then you plateau, and then you stably start to descend as vaccines are initiated, as there's an uptake of vaccination, as the situation, as more information is readily available about what you need to do to get out of the pandemic. And as things go along and they progress, given the information that we have, we can expect that with vaccination and adherence to protocols, that the trajectory will be more positive than it is now.
Okay, thank you. Thank you for that. So on that note, speaking of the long-term effect of COVID, Dr. Wali, I'm wondering if you could tell us a little bit about long COVID, right? So that medical impact that we can have beyond or even after recovery. What can people expect for those who have had COVID? What can you possibly expect? And maybe just some of the implications for that as we're, moving about our daily lives right now.
Okay, so long COVID, I think it's one of the big worries that we're seeing. So most people will, when you get COVID, you could be asymptomatic, so have no symptoms at all. You could have low-level symptoms, or you could be quite unwell, where you could be breathless, you could be in ITU, needing a lot of intensive treatments. But what we found was that after recovery, after the COVID infections, those who survive, even if it's a mild case of COVID, somewhere about 10% are left with long-standing symptoms. And these symptoms are quite variable, very comparable to a condition called chronic fatigue syndrome or fibromyalgia, or what they call myalgic encephalopathy. So people are left with a range of symptoms. It's not just one thing. So it could be fatigue, which is quite common. So tired all the time, persistent headaches, brain fog. Some people are left with, pain in the joints and the muscles, mental health as well. So people are feeling depressed, low mood, excessive anxiety. And this continued. So normally most people would recover, but we go down 4 weeks, 8 weeks, 12 weeks down the line, these symptoms are persisting. And that is one of the problems we see with long COVID. So when you look at 10%, you think, oh, it's a 1 in 10 chance that you'll get it. However, when you look at the total population, if you look at 1 million people infected with COVID, you're talking about 100,000 people with symptoms of long COVID. And these have impacts for the health system as well, about, their impacts for the individual. Loss of employment, people being signed off work because they're just too fatigued or having long-standing symptoms, the impact on the health system because of recurrent appointments, trying to see doctors, different treatments being tried. There hasn't been any particular successful treatment for long COVID, which is also another challenge that we see. So we're having to try different interventions from physiotherapy, mental health medication, exercise programs, and we're still seeing quite a lot of people not recovering, though some of them have recovered. We also found with long COVID that children can also get that. So children, and that's another risk. So loss of school time, problems with education, and also concern for parents when it comes to long COVID. Thankfully, recent studies have shown that it's less likely that children will have long-term, or they tend to recover quicker from long COVID than adults, but it is still a worry. So that is where it's really important. One of the things to worry about COVID is, you could say, actually, I might just have a mild COVID, I don't mind. However, if you are one of those 10 that would get long COVID, that will have a long-term impact on your life. And these are things that one has to consider. So when we're explaining to patients about the vaccines, about making sure you absolutely prevent yourself getting COVID, these are the things that we see. Maybe with time, there'll be more research and we'll be able to figure out what actually is causing long COVID. There are different theories to this, but for now, there's no definite, cause for it, apart from sort of a similar pattern to chronic fatigue syndrome, which has been seen with different viruses in the past, particularly flu virus or the Epstein-Barr virus, which causes glandular fever. So I think it's really important that people tend to know about these, and hopefully by knowing it, I think it's all knowledge. There's a lot of information out there, but obviously go to the right sources. And if you're not sure, ask someone who's in the medical field, and they should be able to explain. And I think that's the key thing, that we need to spread the message to everyone.
Yeah, thanks. So to clarify, if people who have it and they're asymptomatic or they have mild COVID, could they possibly long-term over time experience more serious side effects?
Well, yes, it's been shown that regardless of the type, mild, moderate, or severe COVID you get, certainly the more severe cases tend to have more severe long COVID symptoms. But even cases in mild, COVID infections can be left with fatigue and say, oh, I just had a cold and runny nose and I feel much, I recovered from that, but I just feel tired all the time and I'm just feeling low. I'm not thinking straight. And these are things that some people are returning back to us for. Mm-hmm. So yes, so even in mild cases, you can get long COVID and it can cause long-term health problems.
Okay, so for the people trying to identify whether or not they have it or will have it, can you just tell us like how it's determined that someone has long COVID? Is that something that's fully established yet, or
Yeah, so the key criteria obviously is you must have had COVID to be able to do that. The problem is not everyone gets tested for COVID, and there's no actual test that will determine that you've got long COVID or not. It's just based on the group of symptoms. So it's those symptoms: fatigue, brain fog, breathlessness that may occur for no explained reason in the background of a previous positive COVID infection, either by symptoms or by a positive test. And we have been doing cases where, when we're not sure, someone who's not had a COVID test, you can do antibody testing as well. And we can pick up positive COVID antibodies in these patients. So yes, so there's no fixed, way of testing for it to say, yes, but it's based on the history. So it's a clinical diagnosis based that you do. And hopefully,
yeah, just a couple questions just so we can wrap up that topic there. But is loss of smell and taste part of long COVID as well?
So persisting loss of smell and taste, yeah. Mm-hmm. So it's not, you will get that at the beginning with COVID. So as part of the initial symptoms, and with long COVID, we're seeing, persistence of these. So most people would recover their sense of taste and smell over a period of time. But if it does persist beyond 12 weeks, then it will be part of the long COVID spectrum.
Okay. All right. And finally, before we jump to another topic, because of your experience, could you for us describe what COVID feels like, especially some of the more intermediate to severe cases, so we sort of get an understanding of that as well?
Okay, so the way you look at COVID, the first bit is the virus gets into you. Somehow it could be just a fleeting contact, which we're seeing with the Delta variant, which is highly infectious, 50% more infectious than the previous variants. Now, once the virus gets in, it's down to how your body and your immune response to that virus is. So most moderate people with moderate symptoms, you tend to get the fever, so you get high temperature. The second one is muscle aches, headaches, loss of taste, smell, cough. Usually it's a dry cough, but you can get coughs that are productive as well, and all the way to the level of breathlessness. So how you differentiate between moderate and severe is really it's all down to, it's the breathlessness that actually, separates the moderate to severe symptoms. So there's some that are breathless, but they maintain their oxygen levels, which you can do by a finger probe, where you can monitor the oxygen saturations. And we actually had programs where we sent saturation monitors to people's homes so that they can keep an eye and manage their symptoms at home. However, if the saturations were dropping below a certain number, which is 92% or somewhere below that, it will require admission into hospital and administration of oxygen, and that sort of starts going towards the severe spectrum. So yes, it's really an awful thing, because you can be totally bedridden, everywhere aching, headaches, fever. You can get, diarrhea with COVID as well. And someone explained to me that it's a bit like you've been, you've gone for a marathon and completely your muscles are gone, when you get all the muscle fatigue afterwards, plus the fever, plus a loss of smell and taste, really bad headaches, just totally awful. You try to climb the stairs, you get breathless, and it's really concerning. So nobody wants to get that. And when you see people have that and you assess them, and you just worry that, what if it's you, what if it's someone, or whether, you wouldn't wish that for anyone. So it is important to know that, moderate COVID can be really, really horrible. And the best way is just avoid getting it and don't get it. So that's my advice.
Thank you. It's good, so that we can't just assume, oh, if I get it, I'll be fine. It can be serious, and you can't always predict how your immunity will respond to that, right?
Exactly.
So thanks so much for that. And that sort of brings us to the idea of vaccines and immunity. So I'd like to switch over to you, Dr. Phillip. And if you could, first of all, explain to us the concept of herd immunity, and how that can be achieved, why that's something that we might want to achieve, and then sort of elaborate on the science behind natural immunity versus vaccine acquired immunity.
Sure. So I guess, like, right before I jump into the herd immunity question, one of the things that I realized I didn't say when I was answering the first time is the difference is actually how the vaccines work per se, in terms of how your cells are able to combat it. So in the sense of the AstraZeneca vaccine, it uses more adenovirus construct, right? Whereas the Pfizer is a mRNA vaccine. So the way that our cells produce proteins, right? And as I said, and antibodies are just proteins, right? So the way that our cells produce proteins is that you go from DNA, right? That DNA has the genetic code. And then part of that is given as instructions, and you can think of that as the RNA, which goes outside of the nucleus of the cell, and then gives the instructions to make the protein, right? So in the sense of as we develop that immunity, with particularly mRNA vaccine, you get just the instructions, right? So it has nothing to do with integration into DNA. It's a whole step after, right? And then it gives the cells the instructions to make this spike protein, which is a protein that is present on the surface of the virus, right? So that your immune cells can recognize and then develop immunity against it, right? So that's kind of like the part I forgot to say in the beginning, right? So in terms of herd immunity, you think of it, and probably Nikisha could probably explain this much better than me, but in the sense of what it is in a population level, you're looking at multiple people having some level of immunity against some pathogen, in this case, COVID, right? Ultimately, the goal is to be able to have as much people within the population having immunity against that virus, because what happens is that when these viruses mutate, right? And what we've seen is that the original strains of COVID that we were seeing, and now we're seeing this Delta strains, and there's other strains popping up. And the ones that tend to take over are the ones that are more infectious and so forth. So herd immunity as a concept is mainly trying to get at a point where most of your population has some level of immunity, such that the ability for the virus to mutate and change is lower, right? And you actually don't want the virus to mutate much, because if it mutates a lot, then even though we may have some immunity against, let's say, the alpha strain, the degree of immunity against, let's say, a delta strain may be a bit lower, right? But what we're seeing with these vaccines, even though they weren't developed specifically for the delta strain, you still maintain some level of protection against these other strains, right? And the other part of the question was this natural immunity versus sort of like the vaccine-induced immunity. So whenever anybody is exposed to some pathogen, in this case, COVID, your body should be able to mount a response and give you some level of immunity. But what we see happening is that different people seem to be experiencing different symptoms and different levels of severity to the initial infection, right? And what happens is that it becomes unclear, this variability in how much your body is actually mounting a response in terms of producing the neutralizing antibodies that you need potentially in the future, and the memory cells or the immune cells that have the memory to be able to fight it, right? So you could think of, you have some level of immunity when you have COVID, but once you get the vaccine, even if you've never had COVID, you're essentially like normalizing the field, right? So that's why it's advised that even if you had COVID, if you didn't have COVID, that you should still get the vaccine, because the vaccine is a controlled sort of like response, right? So a lot of studies, the phase 1, phase 2, phase 3 trials have really geared at, the safety and the dosing and all these different pieces. And then what it does, we can sort of calibrate the degree of protection that we have. And then that feeds directly into the herd immunity that, the more people are vaccinated, the higher the chance of getting to that point of herd immunity where you have a population level protection, right? And I think that's, one of the things that a lot of people debate, right? That they say, oh, I'm not going anywhere, I'm wearing my mask, I'm social distancing, I don't need to get the vaccine, right? But the vaccine is just as much as for the people around you as it is for you, right? It protects you, but also protects the people around you, right? Your loved one, your families, your friends, and so forth. So the goal is to have as much people having some level of immunity, some level of protection, as much as possible. And now there's talks of need for a booster for the Pfizer one, which is kind of like a tune-up. You could think of it as that. And as you go, we're still learning. So as more data comes out, the models kind of like we adjust, and then you're able to make the recommendations, like CDC and the FDA and so forth are able to make the recommendations to be able to keep the population as well as the people themselves protected.
Thank you. I think, and you mentioned, Nikisha, with the herd immunity, and I'm wondering if, Ms. Charles, if there's implications that we need to think about with herd immunity and population health when we're looking at vaccines, and then if you can if you have anything to add about that, the herd immunity and population health, and then if we can move into talking about at-risk populations, because I know you work with at-risk and underserved populations, and how our Grenadian community may have some of those characteristics, and what sort of advice you have for us as a community.
Okay, excellent. To Dr. Phillips' point on the natural response to COVID infection, it's operated on the premise and the immunity brought by having the virus and recovering necessarily. It acts on the premise that you would have contracted the virus, period, right? That's the natural immunity part. Now, given what Dr. Wali just specified about the implications of long COVID, even in mild and moderate cases, I think what the vaccine does and vaccination does is prevent that step. You don't have to get infected and possibly suffer the consequences of long COVID and the lasting effects to elicit an immune response to something that is plaguing us currently. So I think that's one benefit of vaccination in context of COVID. We don't have to necessarily wait till we're infected and not know what the outcomes are going to be. And we have a fail-safe, a backup in vaccination that is available that doesn't expose us to infection. Number one misconception that's sometimes there, that it's not that kind of vaccine. Most of the COVID vaccines are not that kind of vaccine. They're not live attenuated vaccines. So we're not exposed to COVID in order to elicit a response to possible COVID infection. So that's one. And as Dr. Philip so well explained, the point of achieving herd immunity is so that the herd, as in the community, is better protected. So it's public health, again, and that's a differentiation from public health and medicine, is that it's about the we and not necessarily the me. So the me works in concert with the we, meaning vaccination is a we thing. It's not necessarily about I and me. It's for what is best for our community. And herd immunity, if we can reach that point, and the threshold that we need to establish for that for COVID has not yet been established statistically. So we're still in the phase where we're trying to get as many people vaccinated as possible. And studies have shown that persons vaccinated against COVID are not, and that's another misconception, not as likely, and that's a very distinct terminology, not as likely to transmit COVID as persons who are unvaccinated. So the likelihood of transmitting the virus when you're vaccinated is lower than the likelihood of transmitting the virus if you're not. And that does not say that you cannot transmit the virus if you're vaccinated, but the likelihood is less. So it's an odds and a risk thing. And just speaking of risk, so at-risk populations, and the risk is any condition in your environment, in your psyche, in your physiology that predisposes you to a certain outcome. And when we discuss risk in public health, it's usually a negative connotation. So meaning there are people who, by virtue of just being female, being born a female, is a risk factor for certain diseases like cervical cancer and things of that nature. So risk is a concept of something that predisposes you to a certain outcome. So smokers are a greater risk of contracting lung disease and things of that nature. Children who are not, who have not, mothers who haven't had at least 6 prenatal visits run the risk of having deliveries that are preterm and underweight. That's just risk calculated based on outcomes. So that's a data point. In the Grenadian context, as far as at-risk populations are concerned, risk is because a main factor of risk for us in the healthcare scope is our comorbidities, are the disease burden of certain things like diabetes, hypertension, chronic kidney disease, the leading heart disease and stuff of that nature. So the health of the population can be termed a risk. The quality of living conditions is environmental risks, mold, mosquitoes, the conditions that people live in. These are things that are considered. Access to healthcare. How often do people seek out preventative medicine? How often do people go to the doctor? How prohibitive are the costs of going to the doctor? So that's risk too. Healthcare being unaffordable or unattainable for most is a risk factor for many in our context. And so in the beginning of the pandemic, when testing and vaccination was not readily available and accessibility is also an issue, that puts a lot of the population at risk for contracting COVID. I don't know I can transmit what I don't know that I have. So if I'm not able to be tested for it, then I can go about the activities of daily living like normal and would have been an asymptomatic carrier, asymptomatic affected, and would have been able to transmit the disease. So with the proliferation of testing and vaccination, risk has been reduced, and the continuing of adhering to COVID policies and protocols will definitely reduce our risk of contracting and furthering the disease in the virus within our community. But in context of general risk of the population, it's the burden of certain diseases as certain illnesses as diabetes, hypertension, chronic kidney diseases, and that's a factor of diets, lack of exercise or environment. So there are risk factors within the community that make us predisposed to certain things, certain illnesses, and certain effects.
Thank you. So with such rampant cases of diabetes, hypertension, or sugar and blood pressure, like we call it in Grenada, would you say that we are vulnerable or could be considered vulnerable as a community when it comes to fighting against COVID?
Absolutely, and we can see it if we do an analysis of the case fatality rate data of the persons who would have died or succumbed to COVID so far. And the term now is underlying issues, right? A lot of these persons would have been people who had underlying issues, asthma, hypertension, diabetes, or people who would have taken a risk factor is taking too long to seek treatment from professionals. That's a risk factor. Staying home and thinking that you can go through it yourself without seeking professional help puts you at risk of experiencing the long-term effects and the deleterious effects of COVID. So our community and the statistics are really available. Like anybody interested can just simply pull up healthdata.org or go to the WHO or IMF world sites and see health-related data as far as the burden of disease on Grenada in comparison to other PAHO and other international countries. We're heavily burdened by lifestyle diseases, as we call it in epidemiology. So previously, the burden of death in many nations was due to infectious diseases, but what we had was immunization and public health and epidemiology coming on stream in the early 19th and late 19th and early 20th century. And we have inoculations against these infectious diseases. So, we don't see a burden of as many people dying of malaria, or as many people dying of tuberculosis, or we've seen smallpox eradicated. But what has happened is that as societies get richer, as places develop, we have a burden of disease that has transitioned to what NCDs are non-communicable diseases, such as lifestyle diseases. We eat a lot. We're able to access the finer things in life as far as food and things of that nature are concerned. So we're more predisposed to hypertension. We're more predisposed to diabetes, to heart disease, and our lifestyle of office jobs instead of farm work, like 9-to-5 jobs have us sedentary and we don't move around as much. So we're burdened by these things. And what these diseases are complementary, and it's a parasitic thing. Infectious diseases love hosts that have these underlying conditions because they're already immunocompromised. So these are the ones within our communities who would suffer the worst effects of infectious diseases like COVID when things like these happen. So moving on to achieve herd immunity is for not those only affected by COVID, but for the health system and for people who have regular, lifestyle diseases. So that, imagine this, and that's a public health concern also. The health system becomes overburdened, right? So when we have to dedicate special beds for persons diagnosed with COVID and ventilators for them, what about the people who would normally go to the hospital for their routine checkups? They get put on a back burner, and these snowball and roll into a host of other effects. And the health system becomes already overburdened. The health workforce becomes overburdened. Nurses and doctors are stretched thin. And the system, which we already complain about, becomes even more burdened by something that can, in most instances, be avoided through safe practices and vaccination. So when we're thinking about the implications of COVID and vaccination, we should think about them in general terms and holistic terms as far as what it means, not just for you getting vaccinated, but what it means for the country and for your community and for the health system, which is already burdened. We should try to alleviate the burden as much as possible. So getting vaccinated is one of the ways that we can do that. and adhering to COVID protocols.
All right, thank you.
And
then
if I could add one
Sure,
thing,
go ahead.
also
Yeah.
the context of age, right? The elderly population, right? So we could think a lot of it in terms of the comorbidities and high blood pressure and these different types of diseases, but age is one of the largest risk factors for disease and death generally, right? So, we know the level of respect and love we have for, the elder ones in our populations, grandparents and so forth. So, it is, getting protected in sense of like, having immunity, vaccinating and so forth also protects them a lot too, right? And conserves that part of our heritage in a sense, right? Because, yeah.
Thank you.
Yeah, to your point, I in context of looking at all the deaths that have been, and I remember when Massa Manuel died, and I was so heartbroken by it. I mean, she lived to 119, and I was hoping she would live to like 120. And these are the elders in our community, and the stories have gone with them. And for the most part, they haven't been moving around, so we can assume that they've been adhering to most of the protocols, So it's a natural assumption that it was, brought in to her wherever she was. And it just it dawned on me like, vaccination and these things could preserve a whole lineage of our heritage. And as with older people passing on, and so do the stories that pass on with them. And so we have to think of it for the cultural and societal benefits of protecting our older population.
That is true. That's such an interesting perspective. When people die, the rich, valuable things that they have to add to the community goes with them as well, right? So it's not just about the numbers, like you said earlier. All right, thank you. Dr. Philip, do you have anything to add about, because we've mentioned some of our cultural practices, but do you have anything else to add about our cultural practices, maybe genetics, or any other factors that may make us vulnerable as a population, but also if there are any strengths that we need to be focusing on and amplifying as we try to fight COVID?
Yeah, I think Ms. Giles covered a lot of it really nicely. I think the age part is one of the ones we should definitely think a lot more about, especially since as we age, there's, our immunity and our ability to fight off infection starts to wane, right? We're not able to do it as efficiently. And in some cases, we mount, like older people could mount very weak immune responses. And the other thing is, like Grenada is a tropical island, a lot of, good fresh air, sunlight and everything. And I think it really plays into the notion of having sort of like a multi-layered approach to staying protected against COVID, right? And so many times we think of them in isolation, right? We think, okay, I'm just gonna stay away from everybody, right? So I'm gonna distance, or I'm just gonna focus on nutrition and make sure I'm eating that good food, good healthy food, right? Or we have some camps that say like, oh, only vaccination, or some camps that says just exercise a lot, reduce inflammation, all these different pieces, right? But I think it's so important to, the advantage of living in a Caribbean island, right? Living in Grenada, you can put all these pieces together, right? So you can get vaccinated, right? You can wear masks, you can social distance, you can, eat well and have proper nutrition, you can exercise, drink water, and you can get your rest and the wonderful sunshine, right? So in a sense, I think it's thinking of it more as a concert, right? So in order to stay protected, you want multiple levels of precautions that you put in place, because in the case that any one of them go wrong, then you have some of these other layers, right? So you want to think of your masking as one layer, your vaccine as one layer, health, proper nutrition as one layer, exercise, sunshine, rest, your belief system and your general mental health, right? In terms of your trust and your faith in God and all these different things. Those all play together, right, to maintain your level of health and sanity and protection, not only for you, but also for the community and the country and the island.
Thank you. I like that. I think a lot of times we think it's this or that, but you're sort of highlighting is this and that and that and that. And we have many tools in our toolbox that we can use to, just approach things. I like that. So as we're thinking about, health and even with vaccines, and we know that there's a lot of hesitancy around it. So I'm wondering, Dr. Wali, if you can talk to us a little bit about some of the major concerns you've seen from the Afro-Caribbean communities when it with regards to the vaccines, and also how do you advise them?
Yeah, so there's so many reasons. I think vaccine hesitancy is, I think it's just reluctance. It's a reluctance to actually have particular treatment, particularly with COVID, is the vaccine. And there are multi-pronged reasons. So people have hesitancy for different reasons. So when you look at the Black and ethnic minority community, it's not just because they don't believe in the vaccine. So some people genuinely have reasons they don't want, they want to avoid the vaccines. Either they've got severe allergies to a component of the vaccine, or they've had a previous severe reaction to a vaccine, and that naturally makes them a bit more hesitant. There are others that listen to things online. They look at all sorts of websites, lots of messages that get passed along to everyone, and that naturally builds up anxiety. But the big thing that we've seen is actually more to do with the mistrust of the health system. And over time, right from time, I think the Black and ethnic minority community feel like the health system has always been against them. And going to hospital, you're going to be probably the one that will be treated last, or you feel like you're not getting the right treatment or attention as someone, from the white community. And that builds up a mistrust of a system. So when now there's a vaccine coming out, people think, okay, this was developed too quickly. How can they, most vaccines take years to make, and then this is being done in months. There's something not right. Alongside all the other information that's coming through. So people are saying, oh yeah, it's got metal in there. They've got nano chips in there. You can get magnetized, so you can get magnets that will stick to the vaccine site. Some people will say that it can cause infertility, it can cause menstrual problems, which will later on lead to infertility. And these are not evidence-based, and these are not proven facts, but because they're out there in social media, people will get them, people will share them, and that makes people who are vulnerable to sort of information kind of think that actually, I'm now worried about this vaccine. I don't want to have this vaccine. And I think the way to tackle the hesitancy, one, is not to go to, oh, this is my brother, I'm going to go advice from him, or go to my sister or to my friends. I think the first step is ask an expert. The people that you would trust, your doctor. So if you weren't feeling well, who would you go to? If you're really feeling unwell, you'll go to your doctor, and I would trust that my doctor would know enough information at least to give me advice. To research the right websites, look at the World Health Organization website. Is absolutely, I don't know if you've looked at it before, but it's absolutely amazing. They've got all sorts of questions. They've got a frequently asked question section, and that explains most of the worries that people have. And it actually has a myth buster as well. So different things, when people say, oh, the vaccine does this, there are responses to that. And I think when you do your research and you ask an expert, and you see, I think as the vaccine rollout continues as well, when you start seeing people taking the vaccine, that's actually what we saw to be the most important push for that encouragement for others to have the vaccine. Because then when you look at other people having it and they're all fine, then you're more likely to accept the vaccine. I think we have, well, in the UK, the government has been using different incentives to people. So saying, if you're fully vaccinated, you can travel. You don't need a COVID test now anymore for traveling. You don't need to quarantine when you come back from where you are. And these are additional incentives that people are being given. But certainly the Black and ethnic minority, I think we need to really focus on education, do the research yourself, ask an expert, and fact check. So if you see any information sent to you, don't just accept it. If you just put it online and ask, is this fact or fiction? There are lots of websites that will kind of explain to you why it's that. And I think never just accept things as they're just given to you. Just say, no, okay, you've said so. I would go and look at it myself, and I'll go and ask an expert. But what we do know is that the vaccines do save lives. We have seen it in the UK. And I think that's being seen across the world as well. So people who are double vaccinated are less likely to catch COVID. And if they do catch COVID, they're less likely to be seriously ill, and they're much less likely to die from COVID. So there's a significant improvement, the death rates. So in the UK, we're getting 36,000, 35,000 cases a day. So that is how much COVID we're having in the UK at the moment. When you look at Grenada, the figures that we have, I think probably somewhere about less than 6,000 total cases that have been recorded since the beginning of the pandemic. So that is, well, we get times 6 of that in the UK. But what we're seeing is that it's a much lower death rate. The death rate is probably less than 0.1% at the moment, based on the total numbers that we're getting. With Grenada, based on the figures, you're getting about a 3% death rate from the positive tests, if you look at the total deaths across the numbers. And it may just be that people are not getting tested, and there are a lot more cases out there. But what you do know is that when the vaccine continues and you start achieving high levels of immunity, that we haven't defined herd immunity, but as you keep going up towards that number, there's a magic number somewhere around 80% or above that people are saying. It all depends on the how contagious the virus is, or how, like the Delta one is a lot more contagious. So that pushes up that herd immunity level to ways numbers above 80% to be able to achieve that. And until we do that, I think you can't not really control the spread of the virus. And so I think when we speak to people, I think it's just really to make them understand that it's not just for as we say, between the medicine, and individual health and public health. You're looking at the greater good. So always think about the greater good, and if that will help, that will be the right thing to do. So people need to look at the facts. I always say, look for the facts, ask an expert, and then make your informed decision. But think about the greater good.
Thank you. I'm glad that you highlighted as well, just like the misinformation. And I'm wondering if the other panelists have anything to add about just how information is circulated and the credibility of information, just from your experience, if you have anything to add about that.
Yeah, so one thing I would say is, just as you look at these, things that come through, let's say WhatsApp or YouTube or something like that, if it's, a lot of times we just want to believe things that like we hear, right? But in the day and age that we live in, anybody can put anything online and say anything, right? So somebody could, just say right now that the, water is pink, right? And then you can get like a whole following like that. But we know, you can see evidence that, the water is not pink, right? You go to the beach and you don't see it pink. So I think a lot of the times it's just like, having an openness of mind when you see these types of information, because excuse, because you can see, information that comes through like some of these WhatsApp or YouTube or Facebook or these social media platforms. And some of them are good. And then some of them are completely false. And then some of them, it's a mixture of truth and false, right? So, as Dr. Wali was saying, you want to be able to make the to differentiate between what is true and what is false, right? And I am of the opinion that, always going and searching for it yourself, and then, going to an expert and so forth is a good strategy, right? Because we all know that game we used to play, telephone as children, right? By the time, the message starts on one end, by the time it gets to the other end, it's something completely different, right? So it's just a matter of, staying informed, know who, credible sources are, right? I think, a lot of these experts, like, nobody really wants to lie to you, but some people are malicious and then some people are not, right? So you just got to know who is credible, what are some credible sources, and does it stand up to real evidence, right? So there's a lot of misinformation about the vaccine that, it kills a lot of people, it's not effective and all these different things. But if you look at the evidence in terms of people who are vaccinated and people who have contracted COVID and died, the evidence can speak for itself, right? Is the vaccine safe? Yes, it is safe, right? Because almost 3 billion people in the world has received one type of the vaccines, right? And you see the level of effectiveness that you get from it. So a lot of it is, credibility, and not everything you get on, WhatsApp or YouTube, just immediately send it, right? So, some people send things to me sometimes and I'll look at it and then, be able to see, okay, this may be correct, but this, may not be, right? So before you spread it to your friends and family and so forth, and some people who may be, undecided, right? On the cusp of deciding, and that could sway them either for good or for bad, right? So you just want to know how to evaluate really credibility. And as Dr. Wali was saying, asking an expert is a great way. Looking at reliable sources, CDC, WHO, FDA, like those different websites provide a lot of the real evidence-based information.
Yeah, I think also in addition to that, it's I think public health officials in the beginning of the pandemic, we have to take a little bit of licking for the messaging surrounding, initially masking, not masking, vaccine efficacy and what guidelines were going to be rolled back. And the general public doesn't usually understand the nuance of evidence developing and guidelines changing. So then we have to look at messaging as far as public health messaging is concerned, messaging towards vaccination, messaging towards guidelines of masking and stuff like, because I remember with the initial success of the Pfizer vaccination in the US, the CDC director, Rachel Walensky, she came out and said, oh, we've successfully combated and we're going to roll back mask mandates. And then the Delta variant came and then things had to be walked back. So the general public is like, if you guys don't know what you're talking about, how are we to believe, So that kind of endears a little bit of mistrust too. And, most people don't understand that science is not to necessarily prove something as true, but it's to discover what's going on. So guidelines will change and things will update as the nature of something as infective and as virulent as COVID-19 and its variants come up. So I think that's one part of misinformation. And again, I think it's honesty in presenting data. You can make data represent whatever you want it to represent in whatever context you want to represent based on how you analyze it. So I think honesty in providing the full picture of what's going on, using credible data to present credible arguments based on scientific evidence and peer-reviewed studies, as opposed to someone on YouTube posting a video, casting aspersions on someone's character in face of better evidence. And I think it asks the general public to be discerning and to research and to find information from credible sources, people who've gone to school for years, who've done this in the field for years. I'd rather to listen to a mechanic about a car, So let's think of it in those terms.
Thank you. I think it's fascinating when you look at just the research on like social media and how your social media just customizes to your preferences. So you Google one thing that's false, and then everything you read after that just happens to be false, and your whole worldview is changed because the algorithm just starts feeding you the things that they think you believe, and you think this is the world, and you don't realize there's a whole other world, a whole other side out there. So I like the message that you're saying, first of all, stop and think when we get whatever. It's exciting, to pass on those videos on WhatsApp and Facebook. It's exciting, but the idea of, stopping and think about it first and taking that social responsibility. Am I sure this is credible before I actually pass it on? I think that itself is really helpful. Thanks so much for that. So I think we're going to just wrap up with a few things. And to do that, and then just look to see if we have any other questions. So I'd like to start with Dr. Wali. Just what are some of the practical tips that you're offering your patients right now to maintain their health during this time, and holistic health, physical, mental, whatever? What are some of the practical tips you're giving them now?
All right. So to be healthy, first, I would say look at three things. One, you make sure you get enough sleep. So rest is very important. So a lot of people are busy doing lots of things. They sleep 2-3 hours, 4 hours a day, disrupted sleep patterns, drinking lots of coffee. And that takes a toll on your body. And anything that stresses your body will drop your immune system. So when you look at holistic medicine, you're looking at the whole body balance. So when your body is balanced, your immune system, everything functions at its peak. So sleep, nutrition is the second one. So obviously when you eat well, you eat the right things, a balanced diet, you don't have to buy all those, multiple packs of vitamins in the home. Just eat 5 a day, fruits and vegetables, a nice balanced diet. Again, that feeds your body, it feeds your immune system, it feeds your mind, makes you feel better, and helps you, fight infections. Now, the third bit, so obviously we talked about sleep, nutrition, and the last bit is exercise, which not everyone does, but exercise is really key. So when you exercise, you get fit, your muscles are better, your heart is pumping at a better rate, you improve your circulation. The blood flowing through your muscles gets rid of a lot of lactic acid and all sorts of what they call antioxidants in your body. And that balance of three, if you can achieve that, you maintain really good health, and it puts you at a much better position in terms of fighting things like COVID. We do know that there are many other infections. So it's not just COVID that is the virus. You've got the flu viruses that are around as well. And colds, coughs, pretty much anything. And when you do those three, even things like long-term health problems like diabetes, hypertension, we have seen that there's certainly a reduction in the risk of developing these conditions if you exercise very well, you keep your weight down, sleep well, and eat well. So the sort of the holistic aspects of health that one needs to maintain. And if you do that in the context of COVID, alongside the preventive measures, so you're doing these to improve your immune system. So you have this barrier. So you're really strong. You have a wall that prevents you, getting the infection. Then you do the other things as advised by public health as well, which means that reduce the risk of the infection getting to you. And that's where the social distancing comes in, wearing your masks, washing, hand washing, using sanitizers, vaccination, all those things would come in. So you look at health in a holistic view. So don't pick just one thing. You have to look at all these multiple areas. And if you do that, certainly you'll maintain, good health, and you will certainly fight infections a lot better. And if that message can get across to as many people as possible, it's three simple things I always say to my patients: sleep well, eat well, and exercise. And if you can achieve those three, you'll certainly achieve good health and better immune systems.
Thanks. I like that. Sleep, eat, and exercise, right? Back to the basics. It can be as simple as that. And then, like as Dr. Phillip was mentioning, we're adding those other tools that we have, preventative measures, whether it's vaccinations or masking or hygiene protocols. And these are the kind of things that we want to be bearing in mind as we fight this. And for you, Ms. Charles, when you're thinking about just population health, what are some of those practical tips you would like to give just from that perspective, the population health, the interpretation of data? What are just some practical things you'd like the Grenadian public to go away with?
So first, on a statistical level, like when surveyed and when applicable, give accurate information, because it's used to help us. There's no cynical or mysterious reason they're asking what your sex is, what your age is, what your employment status is. It's all used to inform public health decisions. So the validity of data is as good as the data that you get. So when surveyed, in general terms, provide as accurate data as possible to help. In terms of practices that improve the health of the population or improve the dynamics of interrelation between the health system and the population, I think I know in the future there are going to be discussions about the public health insurance coming up on stream in Grenada. And I think an interactive and an informed populace is a healthier populace. So when open forums come up, attend these open forums. When bulletins are released, read them through for correct information. Be participatory in your own healthcare, in the mobilization of resources. I think advocacy and militancy for health guided, with effort and deliberate. So it's not the noise in the market is not usually the sale of the fish. So we're going to make deliberate impacts by advocating and being activists for improvement in a deliberate and informed way. So we're not just going to be making noise and arguing and condemning for condemnation's sake. We're going to do it for the greater good. And that's what the public health and population health perspective is. It's a utilitarian principle, meaning maximizing the most amount of good, the most outcomes for the most amount of people. So to that effect, it is like all for one, one for all, when we think of, adhering to COVID protocols, or in general, just providing better information or taking care of our own health and encountering the health system or advocating for a better health system solidly and collaboratively. We're doing it for us, so for family, foundation, and for self. And so I think that's my advice to the Grenadian public as far as healthcare and population health is concerned, advocacy.
Thank you. Thank you. Looking out for our own, right? It's not just about us, but the community. I like that. And Dr. Phillip, on your end, I'd like you to wrap up with this. So you're a man of faith, and I'd like you to just share your personal approach and attitude towards the vaccine, being immersed in science, but at the same time having, religious beliefs. Like, how do you reconcile those?
Yeah. So, my belief system pretty much guides everything I do, right? From the science that I do, when I'm going to do research in the lab or so. And I think for me, it's a critical part in the decisions that I make, right? And I know a lot of people, I've heard a lot of, messaging in the sense that science and faith can't mix, or, faith and the vaccine are contradictory to each other, right? And I, from a personal standpoint, I would say that is untrue, right? I don't see it that way, because science, as Ms. Charles was saying, seeks for discovery, right? There's, I believe that, we are all created to be well, right? To be healthy and so forth. And we were so well and intelligently designed that our bodies have the ability to fight off certain these infections and so forth, right? And I've listened to some of the reasons that some people have given as to like why not to take the vaccine, because it's contradictory to your faith. It's, the mark of the beast, it's chipping, it's, it was created in cells from abortions and all these different things, right? And we can go through the list and sort of like go through and identify, okay, these vaccines that they're giving now are actually not created in mammalian cells, right? They're RNA type vaccines, right? That piece of it kind of like goes out the window. And, regarding like whether it's, the mark of the beast or chipping or things like that, I think that causes you to pause, right? In a sense that not everything you hear somebody say, you should just believe, right? And I think a lot of it starts with that, personal relationship in terms of your own personal study, right? You can go to the Bible and look up and see where these things, fit in, right? And what the Bible says about faith and what it says about works, and think of it through the context that, even though we have faith, and even though people in the Bible had faith, there are certain things that they had to do, right? And why should we limit God enough that he can't heal us through a vaccine? Or that, he needs to just do it without each individual making a move. He can, right? But, that borders on the side of presumption, right? So where faith kind of transforms to presumption. So I think in that sense, I would urge everybody who's, on that debate in terms of faith versus science versus vaccine, that it's not a versus, right? It's more of a collective. And if you, put in the time and in your own personal study or study with, with other people, you can, come up with these answers, right? And see that maybe some of the things that you're thinking in terms of, what this implication is in terms of a vaccine and a mandate is for religious liberty or like these kind of things may be an oversimplification, right? So my admonition would be to, study it out yourself, study it out with people who, as a group, you can think through it and not just believe because you hear somebody say it, right? Because many times we're overthinking, many times we're misinterpreting, many times we're putting something in a place where it doesn't necessarily need to be, right? Yeah.
Okay. Thank you. Thank you so much. Thank you, all of you panelists. I think just your discussions, we had a lot of themes along the ideas of population health, whether it's, physical health, using all the tools in our toolbox to stay healthy. But also another important thing is to do our own research, ensure that the information is credible, and make our informed decisions, right? So it's sort of on us, that social responsibility to make those decisions for ourselves, to protect our families, and for just the larger community as well. So this is the end of our session. I don't believe we have any other questions at the moment. But again, just thank you all so much for joining us. And for those of you out there in the audience, know that we are back here next Sunday at 5 p.m. for another installment of Ask the Expert. And we'll be looking at some other issues related to COVID. So please tune in next Sunday at 5 p.m. All right, thanks everyone. Have a good evening.